Kentucky. We want to welcome to Happy Hour Democratic Congressman John Yarmuth, who joins us now. Not from Kentucky. Is it from Kentucky? It looks like you're on Capitol Hill.
I'm on Capitol Hill, yeah. We're getting ready to vote tonight.
Okay, fantastic. I thought so, because I know a lot of these committees on the Hill, you guys are all there talking about health care reform. So did you figure it out? You've got it all paid for, insurance for everyone without raising our taxes?
Well, we're working on that. The pay-fors are difficult, there's no question about it. But what everyone has to understand, and I think the president put it very clearly today, the option of doing nothing doesn't exist. I mean, we are on an unsustainable path, both in terms of the national economy, the federal budget, and the individuals' pocketbooks. We're looking at possibly in 8 or 9 years family premiums being $25,000 a year. There's virtually no company that can afford to pay that for their employee coverage, and neither can any individual. We know that Medicare is facing possibly a $50 trillion deficit over the next 75 years. So refusing to act or not acting and not acting decisively is not an option right now.
Well, Representative, then what, let's attack it. How do we pay for it? I mean, is this going to be a $1 trillion cap and trade? Is it going to be raising the taxes on the middle class like Obama promised he wouldn't? How do you come to this number? It's anywhere between $1 trillion and $1.5 trillion, depending on who you listen to.
Right. Well, we're talking about what is essentially $100 billion a year for 10 years. That's about 20% or less of what we'll spend on defense during the same period of time. So you have to put it into perspective. The administration's identified somewhere around $900 billion over those 10 years in savings if we restructure the way Medicare compensation's done and Medicare reimbursement's done, some other reforms. We're looking for somewhere around $40 billion a year or so in additional revenue. One of the things that I think is definitely on the table is raising taxes on those who make more than $250,000 a year, which is consistent with what the president campaigned on, what many of us have advocated for a long time. So I don't think it's an impossible task to figure it out. Now, getting consensus in 2 houses of Congress is another question.
Congressman, thanks for joining us. Do you regret the fact that you sent $800 billion to Wall Street and you could be using that to pay for all of this?
Well, of course, we all would have preferred not to do that, but the truth of the matter is, I think everybody agrees that if we had not done that when we did it, we would have faced a worldwide financial collapse. Okay. Well, a lot of people do.
Congressman, can I ask you, what's the cheaper option, not doing anything or spending the $1 trillion or $1.5 trillion to do something with health care? What's cheaper?
Oh, I think it's much cheaper. We had Christine Romer here last week in the Budget Committee, and she said clearly not acting now is going to add $2 trillion every year. It's going to cost us $2 trillion every year for not acting. So we've got to act, and we haven't talked about the public insurance option, but that's something the president addressed today. And the alternative to that is saying we're going to trust the insurance companies to fix it all. And the notion that they can't compete and add value, if all they're going to do is charge more than the government would for the same services, then all we can conclude from that is that the American people are overpaying for what they're getting. And that's, they're paying people like the head of United Healthcare $320 million over 6 years.
I'm still trying to just grasp this. So you're saying we should socialize health care to try and scare the private sector medical profession into lowering their prices? Is that what you're suggesting?
Well, no. What I'm saying is that by giving them competition, and you remember the insurance industry is the only industry other than Major League Baseball that's exempt from the antitrust laws. By giving them competition, you force them to add value above and beyond just the difference in price. I represent the district which is the home of Humana, a great insurance company which has figured out how to add value to their product in Medicare Advantage. So competition will help them do that. If we don't have some public vehicle that can do the same thing more economically, then there's no pressure on them to do anything. On the insurance companies.
Kentucky Congressman John Yarmuth, thank you very much for joining us for Happy Hour.
My pleasure, Rebecca.
Well, like his predecessor,